If you like this video, press the like button and subscribe this channel and press the bell icon to get notification of our new videos.
Hello everyone, welcome to mpcs.com. So this is our sixth lecture on dermatology series. The topic is nail disorders. We had already discussed 5 lectures and you can watch those lectures. The link is given in the description below, and also I request you to download the notes of this lecture. The link is given in the description below. So before going to the nails disorder, you should know the structure of the nails. Okay, so the structure of nail, I draw this diagram. This is a finger and we can see a nail here. So there are many parts of the nail. This is nail plate. Okay, this is lateral nail fold. This part, a semicircular part or a moon shaped part, is known as lunula. Okay, this fold is known as proximal nail fold. Okay, so these are the parts, and lastly we have cuticle here. Okay, this nail plate is also known as nail matrix, and this lunula is visible nail matrix. Okay, now this diagram is lateral view of the nail. Now we can see what we can see here. We can see the nail plate. This is the nail plate. This part is nail bed where the nail rests. This area is known as hyponychia, and this part is known as aponychia. Okay, so this is the structure of the nail. Now coming to the disorders. So the first disorder of the nail is pitting. So as you can see in this diagram, I draw this diagram and I have drawn the pits between the nails. So what is pitting and how it occurs? This occurs because of focal parakeratosis of proximal nail matrix. Parakeratosis of proximal nail matrix. So what are the condition which leads to the pitting? These are psoriasis, alopecia areata, as we had discussed in our previous video, and lastly eczema. Okay, in psoriasis we have thimble pitting, thimble type of pitting. Okay, in alopecia areata we have geometrical or bisymmetrical pitting. Okay, now coming to nail changes in the psoriasis. So what are the nail changes in the psoriasis? This is most common is pitting. Pitting is present in the psoriasis, and most characteristic is oil drop sign, or we can also say Selbin patch. Okay, so this is the nail change in the psoriasis. Now coming to the nail changes in the lichen planus. As you can see in this diagram, I draw this part. The nail has a pterygium. Pterygium is characteristic. Pterygium is present in lichen planus. Now coming to another disorder, which is infection of the nail fold. So the main nail fold which can lead to the infection, this is hyponychia. Okay, hyponychia. What is hyponychia? Hyponychia is this part is the hyponychia. This is most commonly involved in the infection of nail fold, and this infection of nail fold is known as paronychia. This is known as paronychia. It can be acute or it can be chronic. If it is acute, the most common cause is Streptococcus aureus, or it is a bacterial cause, and in chronic part, the fungal infection is common, so it is Candida part. Candida. Okay. Now coming to another one, which is leukonychia. So what is leukonychia? Leukonychia is whitening of the nails. So whitening of the nails. There are three types of whitening, which can be named as terry nails, half and half nails, and banded nails. As the name suggests, terry nails. So the terry nails involves whole of the nail. Whole of the nail is involved, then it is known as terry nail. If half and half means this part, if this part is involved only, then half, then half and half and half nail is involved. This is known as half and half nail. Now coming to banded nail. What is banded nail? We have multiple bands of white nails here. If this is white and this part is white, then this is banded nail. The terry nail is common in hepatic failure and CHF. Half and half nail is common in CRF, chronic renal failure, and banded nail is common in chemotherapy and hypoalbuminemia. So this is all about the nails disorder. So this is all for this video. Hope you like this video. Please press the like button and also share this video with your friends, and also subscribe our channel for more videos, and we will try to complete this subject in this month. So please subscribe the channel, press the bell icon for the early notification. Thank you.